February is American Heart Month, a time for everyone to take a step back and learn more about what it means to be heart healthy. We sat down with Dr. Teresa Daniele to talk about what that means and what you should be staying on top of all year long. February being Heart Month, it is an important time to kind of take a closer look at that aspect of our health. So what exactly does Heart Month mean?
Heart Month is an exciting time of year for me. It is a month where we showcase cardiovascular disease for both men and women. It is still the #1 killer for both men and women, and it is a time where we can focus our attention to educating the public and highlighting the disease process itself, and shifting our focus to prevention and how we can beat and combat this disease.
And thinking about women specifically, those symptoms can be a little bit different, and a lot of times women aren't paying particular attention to their heart. What do you advise?
Women almost never pay particular attention to their bodies in general. Let's face it, we're very busy. We are generally the main role models in our family. We are working, we have careers, we take care of children, and who has time to be sick, right? So we oftentimes minimize our symptoms or really not pay attention to our symptoms until it's too late and an event has happened. And to make that even more complicated, women's disease is a little different than men. Therefore, our symptoms are very different. They can be much more mild than men. We've grown up knowing about the crushing chest pain that goes down, radiates down the arm, and we normally see on TV. It's usually a male actor that portrays this. I generally never see this with women. It's much more subtle. They come in with complaints really of shortness of breath, and shortness of breath that doesn't go away, or they have right-sided chest pain or heartburn and indigestion. Sometimes it's pain that goes along the neck and jaw area, and they think it's a tooth, and they visit their dentist for many, many months.
So what are some tests that we should be looking out for? What should we be asking our doctor for?
We should know, and I always like to look at it as the ABCs, right? Know your age. As we increase in age, and especially for women, as we come around the perimenopausal period, which is around the 50s, our chances of having cardiovascular disease skyrockets. It really increases. We lose our natural estrogen protection. B is your blood pressure. Know your blood pressure numbers. Understand that you have significant risk if your blood pressure is high all the time. C is cholesterol. D is for diet and diabetes, right? So know your blood sugar numbers. If you are diabetic, we consider you as already having had a heart attack. That is how much at risk you are for having a heart attack. And so you know your numbers, get screened, and diet. One of the things you can do to avoid becoming diabetic is eat a moderate diet. Don't have a diet filled with fat and fried foods and sugar and sugary beverages and so forth, because that's going to increase your risk extensively. You can't hide from genetics. So if you have a genetic predisposition of having disease, you have many family members that have had heart attacks early on in life, you have to get screened and treated effectively early on in life.
All right, Dr. Daniele,
Absolutely.
thank you so much. We appreciate it.
Thank you. It was a pleasure.
There's an opportunity coming up to make sure you are all caught up on your heart health. UCSF Fresno, on the campus of Community Regional Medical Center, is hosting the 5th annual Women's Heart Fair on March 2nd. It's from 10 a.m. to 2:30 p.m. in the UCSF Fresno Center for Medical Education and Research. Along with educational seminars, you can also get tested for cholesterol and glucose, blood pressure, height, weight, BMI, hepatitis C, and liver scan. All tests are free. For more information, check out fresno.ucsf.edu.